The fluorescent lights buzzed like insects trapped in plastic. 05 for 7 hours. Sacred Heart Hospital in Houston hadn't fully woken yet, but Ashley Cooper already had. She moved through the ICU with the kind of silence that comes from years of doing things quietly, the kind of quiet that meant you'd learned not to draw attention. Her scrubs were navy blue, standard issue, unremarkable. Her hands told a different story. A burn scar ran from her right wrist to her elbow, thick and silvered, the kind of scar that came from pulling something precious out of fire. When she reached for the chart at room for 47, the fluorescent light caught it, and for a moment it looked almost like a medal. The sergeant major lay motionless on the bed. 2 years of motionless. Tubes ran from his chest like mechanical roots, tethering him to machines that breathed for him, that cleared his secretions, that kept his body alive in the way bodies could be kept alive when the mind had gone somewhere else entirely. The ventilator hissed its rhythmic breath. In. Out. In. Out. Mechanical precision. No will behind it. Ashley didn't start with the machines. She never did. She started with the patient. Her penlight came out, a simple thing, unremarkable, but she held it like a tool she'd used 1,000 times before. She checked his pupils, watching for that slight contraction that meant the brainstem was still firing, still working, still home. Her fingers were steady as a surgical laser. Left eye. Right eye. The light made tiny reflections in his iris, small moons in a darkened sky. "Good morning, Sergeant Major," she said quietly. No one was listening. The night shift had already moved to their next task, their next patient, their next reason to exist in this building where people came to be fixed or to stop needing fixing. "I'm going to check your breathing today. You're going to let me do that, and then you're going to rest." She didn't expect an answer. 2 years meant there would be no answer. 2 years meant the neurologists had already written the summary, persistent vegetative state. Global anoxic brain injury from the IED blast outside Fallujah. No cognitive function. No purposeful movement. The family had made their peace with that, had visited less frequently, had finally stopped visiting at all. Sacred Heart kept him on the state insurance, on the ventilator, on the very expensive business of maintaining a body when its occupant had already left the building. Ashley knew better. She pulled the tarnished challenge coin from her scrub pocket. The motion was habitual now, something she'd been doing during rounds for the past 6 months since the sergeant major had arrived. The coin was old, beaten smooth by hands that had held it during prayer, during despair, during the kind of moments when metal was all a person had between themselves and the infinite. One side showed an eagle, worn nearly featureless. The other side showed a building that might have been a mosque or might have been a school. On Baghdad streets, sometimes the difference mattered. Sometimes it didn't. She turned it over in her palm. Once. Twice. The metal was warm from her pocket. The sergeant major's chest rose and fell with the ventilator's rhythm. No independent breathing. No spontaneous effort. Just the machine doing what machines did, continuing, persisting, maintaining the minimum requirements for a body to legally be called alive. Ashley had held the hand of patients like this before. Had held their hands while their families said goodbye. Had held their hands during the unplugging, when the hiss of the ventilator finally stopped and the room became so quiet you could hear the fluorescent lights humming their electrical song. But she held this hand differently. His hand was warm. Nurses turned these patients, moved their joints, massaged their limbs to prevent contractures, kept the machinery of the body from rusting shut. It was good care. It was competent care. It was also, Ashley knew, care that came from protocol rather than conviction. These patients were maintenance. They were bed-occupied hours. They were the reason Sacred Heart's ICU always had a waiting list, why families begged for one more bed, one more slot, one more chance at the miracle that came in the form of consciousness returning after the doctors had already written it off as impossible. Ashley pulled a chair close to the bed. She was supposed to be moving to the next patient. The sergeant major wasn't acute. He was stable. He was long-term. He was exactly the kind of patient Dr. Whitfield had once described in a staff meeting as high maintenance, low probability, a phrase that had made several younger nurses glance at Ashley, knowing she'd understand what that meant. It meant resources that could go to someone who might actually recover. It meant bed space that could go to someone worth saving. Ashley placed the challenge coin on the bedside table beside the water pitcher and the call button no one would ever press. "I pulled a little girl out of a burning building in Baghdad," she said quietly to the motionless form in the bed. "About 14 years ago now. She was 7 years old. Her name was written on a school uniform, the part that didn't catch fire. Her house was burning. The whole block was burning. IED had gone off maybe 20 minutes before, and everyone was still running in wrong directions, still thinking it was an accident, still thinking there would be more of them coming. The machines beeped their regular rhythm. O2 sat at 97%. Heart rate steady. BP holding at 118/74. Stable. Always stable. The sergeant major was exceptionally stable. That was part of what made it heartbreaking. You were wearing the same uniform. Same age, basically. I got the girl out because she was burning. I got you out because someone yelled your name, and I wasn't going to leave anyone burning on that street." Ashley reached over and straightened the patient's left arm, checking for contractures, feeling for the give and resistance of muscles that hadn't moved under their own power in 24 months. "You grew up. She grew up. And somehow you ended up here, in room for 47, and I ended up here too, and I need you to know that I see you." The ventilator hissed. The monitors beeped. The ICU continued its low-level symphony of beeping and hissing and the occasional alarm that meant someone's oxygen had drifted or someone's heart had skipped a beat or someone was asking the machines for something the machines couldn't quite provide. Ashley sat for another minute in the chair she'd pulled close. She wasn't supposed to be here. The sergeant major wasn't her assigned patient. She'd picked this particular room during her volunteer overtime, the shifts no one wanted, the shifts that came with no additional pay and all the watching of patients who had been written off as non-recoverable. Other nurses had asked her about it. "Why waste your time on someone who isn't going to wake up?" Dr. Whitfield had asked it with his eyes, though not yet with his mouth. That would come later. That would come in a staff meeting when he decided that Ashley Cooper's unusual attention to a patient with a prognosis of permanent unconsciousness was worth mentioning to the room. But not yet. Not this morning. This morning was still quiet. The fluorescent light still just buzzed, and the machine still just did what machines did, and the sergeant major still lay motionless in his bed with a tarnished challenge coin on his bedside table next to a water pitcher he would never drink from. Ashley stood. She picked up the coin and placed it back in her scrub pocket, where it settled against her ribs like a secret, like a promise, like something she had been carrying for 14 years waiting for the person it meant to finally hear it. She was checking the ventilator settings when the elevator dinged. The sound cut through the ICU like a knife through water, distinct, sudden, a violation of the quiet that had held up to that moment. Ashley heard the door slide open. She heard shoes on linoleum, the kind of shoes that cost more than most people's monthly rent, the kind of shoes that clicked on tile with the confidence of someone who had never been afraid of making noise. Dr. Whitfield stepped onto the floor. He was tall in the way that had nothing to do with height and everything to do with how he moved his shoulders, how he held his chin, how his eyes calculated the hierarchy of every room he entered within approximately 3 seconds of arrival. His white coat was pristine. His stethoscope draped around his neck like a piece of jewelry. He carried a tablet that was undoubtedly full of patient information, lab results, consultations, all the data that made medicine feel like mathematics and medicine like a game that could be won with sufficient information and sufficient certainty. His eyes found Ashley immediately. She was still standing at the sergeant major's bedside. The chair she'd pulled close was visible. The ventilator settings she'd been reviewing were displayed on the small screen. To any observer, it would have looked like she'd been spending time here. Unusual time. Unscheduled time. The kind of time that suggested she cared about this particular patient in a way that extended beyond protocol. Dr. Whitfield's smile arrived before his approach did. "Good morning, "Cooper," he said. His voice was the kind of voice that sounded friendly until he realized it was performing friendship rather than experiencing it. "Working on the long-term cases this early?" Ashley turned. She met his eyes with the kind of composure that came from having already learned not to react to being studied like she was under a microscope. When your eyes had watched artillery illuminate a night sky, when your hands had worked in light that came from burning buildings, a smile from a hospital administrator looked like what it was. A smile. Nothing more. "Routine assessment," she said. Her voice stayed level. Not deferential. Not challenging. Just stated. Just fact. Sergeant Major's vitals are stable. Indeed. Dr. Whitfield glanced at the monitors, then back at Ashley. "Though I wonder if your time might be better allocated to patients with a more favorable prognosis. We have 3 patients in the acute section who could benefit from your attention." The way he said it was almost kind. That was what made it dangerous. It wasn't cruelty. It was efficiency masquerading as good judgment. It was the kind of statement that would never, when reviewed later, look like anything other than sound medical practice. Ashley felt the challenge coin in her pocket, warm against her ribs. She said nothing. "I'll note your morning assessment in his file," Dr. Whitfield continued, still smiling. "Though I suspect we both know how this story ends. 2 years is a very long time to maintain hope on a permanent vegetative state patient. At some point, resources and compassion diverge." He turned to leave, his shoes clicking on the tile, heading toward the nurse's station where the real work was, the acute cases, the patients who could still be saved, the patients whose charts made sense and whose futures hadn't already been decided by neuroimaging and time. Ashley looked back at the sergeant major. His eyes remained closed. His chest rose and fell with the ventilator's rhythm. 2 years of rising and falling. 2 years of being maintained. 2 years of waiting. But that wasn't the worst part. The worst part was that someone would have to explain why she cared about this particular patient. Would have to explain why she spent her unpaid hours in room for 47 holding a hand that couldn't hold back. Would have to explain that she knew something about the sergeant major that his chart didn't say, that she had a history with this patient that extended back 14 years and 3 continents and a burning building where a 7-year-old girl had run toward the fire instead of away from it. The worst part was that Ashley couldn't explain any of that without revealing exactly who she was. And Dr. Whitfield was already starting to wonder. Conference Room B at Sacred Heart Memorial held the metallic smell of stale coffee and fluorescent-lit anxiety. 17 nurses arranged around the laminate table, a Wednesday afternoon ritual that nobody enjoyed and everyone attended. Dr. Whitfield stood at the head of the room, his posture a vertical line of privilege, PowerPoint glowing behind him like a threat. Ashley sat 3 chairs from the back, her hands folded, her expression the kind of neutral that takes practice to maintain. The pharmacology protocol updates were standard, dosages, contraindications, the baseline competence that separated nurses from orderlies. Whitfield clicked through slides with the precision of a prosecutor building a case. Then he stopped mid-sentence, his eyes landing on Ashley like a spotlight finding an actor mid-stumble. "Nurse Cooper," he said, his voice smooth as oil on water. "Since you're so attentive, explain the pharmacological cascade for vasopressor administration in septic shock." The room temperature shifted. Younger nurses straightened in their chairs, suddenly very focused on their notebooks. Ashley had answered this question 100 times in grand rounds, in staff meetings, in the casual hallway conversations that medical professionals use to sharpen their knowledge. The answer was automatic as breathing. "Norepinephrine is first line," she said, voice level. 0.01 to 2 micrograms per kilogram per minute, titrated to mean arterial pressure above 65. Renal perfusion maintains at that threshold. If norepinephrine alone doesn't restore perfusion pressure, you add vasopressin, 0.04 units per minute, concurrent with the catecholamine, not sequential. Whitfield's smile widened. The smile of a man who has set a trap and watched prey step into it. "And the renal clearance calculations? Walk us through hepatic metabolism in a patient with elevated creatinine." Ashley quoted clearance formulas, cited exceptions, mentioned the studies, surviving sepsis campaign guidelines from memory, the kind of granular knowledge that comes from reading literature late at night when a patient won't stabilize and you want to understand why. Her jaw remained still. Her voice remained calm. She might have been describing the weather. Interesting, Whitfield said, letting the word hang in the air like a bird of prey. You know theory better than some residents, yet you're still just a nurse. The words landed. They were designed to land. The younger nurses examined their laps as if the answers to life's mysteries were printed on the laminate. One of them, a girl who couldn't have been more than 2 years into her career, looked at Ashley with something like pity. Ashley nodded once, a small dip of her chin. "Thank you, Doctor." She returned to her notes without expression. Her jaw had clenched for perhaps half a second, imperceptible to anyone not trained to observe human behavior under pressure. The trembling wasn't fear. It was restraint. That restraint was her power, and Whitfield didn't recognize it because he'd never had to survive anything that required it. The meeting continued. Nobody else spoke unless directly addressed. When it ended, nurses filed out in clusters, offering Ashley the small careful distance reserved for people who've been publicly humiliated. She stood, placed her notes in her bag, and walked to the ICU with steady hands. Thursday afternoon arrived with the weight of accumulated small cruelties. Ashley pushed a medication cart toward the elevators, for pumps and saline bags arranged in careful order, the routine of patient care. The elevator doors opened. Dr. Whitfield stepped halfway out, positioning himself in the doorway threshold with the confidence of someone who believed physics and protocol bent to his preference. "Nurse Cooper," he said, maintaining unbroken eye contact. The eye contact was deliberate. It was dominance, a display of comfort with confrontation that most people associate with safety, but this was different. This was a man ensuring she couldn't look away from what he was about to take from her. "About room for 47, that's being reassigned to 4th floor neurology effective immediately," he said. "You'll take the post-surgical overflow from units 451 through 456 instead. Ward census management. Nothing personal." Everything about the delivery was personal. The timing, the location, the audience of passing staff. The way he'd waited until she was alone, then ensured she wasn't. "That vegetative patient needs specialists," he continued, his voice dropping slightly lower, more confidential. "Not enthusiastic generalists." He gestured at her scrubs, the gesture itself a kind of dismissal, as if her credentials were woven into the fabric and he could wash them away in the next laundry cycle. The elevator doors tried to close against his shoulder, detected the obstruction, bounced open again. He didn't move. Ashley processed the information with the same clinical precision she'd used on the pharmacology quiz. Room for 47 was the sergeant major. 2 years post-coma, prognosis terminal, a patient most nurses accepted as a bed that took resources without producing outcomes. Whitfield had weaponized exactly that fact, removing her from the case while appearing to do her a favor, reassigning her to overflow surgical patients who demanded constant attention and offered no time for anything else. "Understood, Doctor," Ashley said. She turned her medication cart around with movements that could have been carved from stone. The cart's wheels squeaked against the tile floor, a small sound that seemed louder than it should have been. She didn't wait for him to move. She backed the cart away, repositioned, and headed toward the post-surgical units. Behind her, she heard the elevator doors close. She didn't turn around. The people she passed in the hallway would have reported that Nurse Cooper looked composed. Unruffled. The kind of person who rolled with punches because she'd always had to. What they didn't know was that the sergeant major in room for 47, the patient Whitfield had just stolen from her care, was 7 years old in an adult body, rescued from a burning building in Baghdad by a combat medic who'd carried her out through smoke and mortar fire 14 years earlier. What they didn't know was that there was a tarnished military challenge coin in Ashley's locker, a gift from a grateful Iraqi family, carried through 2 decades because certain people change your life and you carry the memory in metal instead of scars. Friday morning came grey and ordinary. Ashley opened her locker in the staff changing area, muscle memory taking her through the rotation of the dial, the swing of the door. Someone had been here. Someone had taken a permanent marker, black, probably from the nursing station desk, and written across the front of her stethoscope case in letters 3 inches tall, "Nurse Nobody." She stood there for 3 seconds. Her hands didn't shake. Her breathing didn't quicken. She simply stared at the letters as if they were written in a language she was considering learning, clinical and distant. Then she reached for the case, opened her bag with methodical care, placed the stethoscope inside, and closed the locker door. The click was quiet. Final. She walked back to the ICU ward, her badge bouncing slightly against her collarbone. The day's assignment was waiting post-surgical patients in rooms 451, 452, 453, 454, 455, and 456. Wound checks. Pain management. Monitoring for complications. The work was important, surgery always needed careful watching, but the work kept you moving, kept you anchored to the present tense, kept you from thinking about patients you'd been removed from or challenges you couldn't meet because you weren't authorized to try. During her 15-minute break, Ashley found herself walking toward room 447 anyway. The nursing station records showed the patient had been transferred to neurology, but people were creatures of habit, and the door to room 447 was still there, still accessible, still belonging to a person whose name was listed in the hospital database as Marine Sergeant Major, rank, service, a person worth remembering. She stood beside the bed. The sergeant major's chest rose and fell with mechanical precision, the ventilator's rhythm a steady wheeze that had been the patient's heartbeat for exactly 2 years and 14 days. Ashley reached out and held the sergeant major's hand. The skin was warm from the bear hugger blanket draped overhead, hospital equipment designed to maintain core body temperature, designed to keep people alive while waiting for consciousness that might never return. She turned the challenge coin over in her palm, the tarnished edge catching the fluorescent light. The coin was older than room 447's occupant, older than the 2-year coma, older than the Baghdad fire that had changed the trajectory of both their lives. It was metal and memory combined, a reminder that some people save you and stay in your life even after decades of distance and transformation. The cardiac monitor's rhythm remained stable. Steady. Unremarkable. Dr. Whitfield watched from the nurse's station, observed her hand-holding through the observation window, made a note on his tablet. But that wasn't the worst part. The worst part was what he had no way of knowing, that the person he was punishing had spent 22 years saving lives in places where saving lives meant understanding death, learning to read its signals, recognizing its approach with the accuracy of someone trained to fight it at every level of escalation. She had commanded a medical battalion across 3 tours. She had made decisions that affected hundreds. And now she was a general working as a private, and he was using a comatose patient as leverage to demonstrate his authority in a hospital where her quiet competence had already begun to threaten everything he believed about his own importance. The room was still. Outside, Houston's afternoon heat pressed against the windows. Somewhere in the building, a code blue alarm had just activated. Somewhere else, a family was receiving bad news in a consultation room that always smelled like artificial flower spray and resigned acceptance. And in room 447, a Marine who'd been 7 years old in Baghdad slept on, waiting for something none of them could predict. Emma pushed her chicken across the plate in lazy circles, the fork scraping against ceramic in that particular way that made Ashley's jaw tighten almost imperceptibly. The girl was 7 now, same age Ashley had been when she first understood what fear smelled like. Outside the kitchen window, Houston sprawled under an orange-pink sky that looked like a bruise healing. "Mommy, why don't you talk about the before job anymore?" Emma's voice carried the casual precision of children who notice everything adults assume they've forgotten. Ashley set down her fork. The weight of the question settled across the table like a patient monitor going quiet, that absence of sound that actually meant something was wrong. She looked at her daughter's face and saw the same determined jaw she'd seen in a 7-year-old girl being carried through smoke and rubble in Baghdad 14 years ago. Because, Ashley said quietly, some jobs change you. And when they change you, it's hard to explain to people who weren't there. Were you a soldier? The word hung there. Soldier. Not nurse. Not the woman in scrubs who came home smelling like antiseptic and hand sanitizer. But soldier, the thing that lived underneath, the thing that Emma's instincts had somehow always known was there, even if her words couldn't quite find it yet. Ashley said. She met her daughter's eyes. A long time ago. In a place very far away. Were you good at it? Ashley didn't answer for a moment. She thought about 3rd Battalion, 5th Marines. She thought about 214 souls under her command. She thought about the girl in her arms, coughing through the smoke. Yes, she finally said. I was very good at it. Emma nodded as if this answered something she'd been carrying. She went back to pushing her chicken. Ashley went back to her quiet, and the silence between them was the comfortable kind, the kind that comes from understanding. But that was Wednesday evening. Thursday morning brought the official hospital schedule. Ashley found it in the break room, posted on the bulletin board beside the birthday announcements and the sign-up sheet for the charity 5K run nobody had signed up for yet. Room for 47. Long-term care facility. Friday 0600 hours. Effective immediately. The signature at the bottom was crisp, authoritative, unmistakable. Dr. James Whitfield, MD, Chief of Internal Medicine. She didn't tear it down. She didn't let anything show on her face. She simply read it twice, memorized the facility name and the time, and walked back to the nurse's station to check the patient assignment board. Her shift started in 6 hours. She had until Friday morning. 28 hours. The math was simple. The options were simpler. Dr. Whitfield had just weaponized her past without knowing it. The challenge coin was in her scrub pocket when she clocked in Thursday night. She could feel its weight, not physically, it was only about 18 grams, but spiritually, emotionally, in that way things carried mean more than things held. A gift from a grateful Iraqi family in 2004. The only tangible proof that she'd saved someone who mattered, that the blood on her hands had meant something, that when she carried a burning 7-year-old girl out of a collapsed building on the edge of Fallujah, it had been worth the cost. Now that girl was in room for 47, and room for 47 was being moved to a hospice facility where patients went to die slowly, painfully, without the aggressive interventions that acute care hospitals provided. No surgeries. No emergency procedures. Just comfort measures and the sound of a ventilator counting down someone's remaining days. Ashley walked the halls in her scrubs like every other Thursday night, checking on her assigned patients, charting vitals, hanging antibiotics. Her voice was soft when she spoke to patients. Deferential when she addressed the younger residents. Invisible to Dr. Whitfield, who passed her twice without acknowledging her existence. This was the mask she wore at Sacred Heart, had worn for 4 years. The quiet trauma nurse. The one who showed up early, stayed late, never complained, never pushed back. Just a nurse. Except at 0200 hours, when the floor was 3 nurses and 1 resident down, when the ICU was running at capacity and the emergency department had called back every available hand, Ashley found herself walking past the nurses' station toward the east corridor. Room for 47 was off her assignment. Dr. Whitfield had been explicit about that. And yet her feet carried her there anyway, muscle memory from a different kind of leadership, from a time when she'd answered to something deeper than policy or procedure. The window was dark. The unit was quiet except for the hiss of the ventilator, that mechanical breathing that had been going on for 2 years without interruption. Ashley glanced both ways down the corridor. No one. The night shift nurses were buried in documentation, the residents were somewhere else entirely, the attending physicians were in the resident lounge probably sleeping or pretending to. She entered room for 47 without knocking. The monitor showed a regular rhythm, green lines tracing across the screen with mechanical certainty. But something was wrong with the patient's chest. It was moving in the wrong way, the opposite way, a paradoxical pattern where the ribcage caved inward instead of expanding outward with each breath. Beck's triad. That's what the sign spelled out to anyone trained to read them. Muffled heart sounds. Distended jugular veins. Low blood pressure. Cardiac tamponade. Fluid accumulating inside the pericardial sac, crushing the heart like a fist closing around a bird. Ashley pulled her stethoscope from her pocket and listened. The heart sounds were indeed muffled, distant, as if the organ were speaking to her from underwater. She placed her hand on the sergeant major's neck and felt the pulse, thready, fast, racing against the gathering fluid. The pulse pressure was narrowing. The patient was crashing slowly, gracefully, silently. Without intervention, death would come within the hour. Maybe 2. Not the dramatic sudden death of a massive MI, but the quiet asphyxiation of a heart suffocating inside its own cavity. She moved to the portable ultrasound machine in the corner of the room, booted it up with her hands moving in that automatic way, the way they'd moved through 100 field surgeries. The screen flickered to life. She positioned the probe, found the heart immediately, and there it was. A massive pericardial effusion, the space around the heart filled with fluid, the organ barely visible inside the compressed space, like something drowning in its own sea. Ashley reached for her phone. Paged the on-call resident. Got voicemail. Paged again. And again. Nothing. The resident was probably asleep in the call room, phone on silent, the way they always were. Protocol said call for help. Protocol said wait. Protocol said this patient was off her assignment and if she touched her, if she intervened without an attending present, it would be a violation of hospital policy, grounds for dismissal, the end of her nursing career at Sacred Heart. But protocol was written by people who'd never held a 7-year-old girl in their arms while she coughed blood into their shoulder. The crash cart was 2 steps outside the door. Ashley grabbed it, wheeled it silently into the room, and closed the door behind her. Her hands were steady as she opened the pericardiocentesis kit, the sterile field already laid out, the needle inside glinting silver under the fluorescent lights. The kit included everything, a 14-gauge needle, the tubing, the catheter, the fluid bag. Everything except the authorization to use it. I'm going on break, she whispered to the monitor, a ghost of something like dark humor crossing her face before it vanished. Going to be gone exactly 5 minutes. The needle felt familiar in her hand. The anatomy was simple, between the 5th and 6th ribs, just to the left of the sternum, angling up toward the left shoulder. She'd done this before, dozens of times, in field hospitals where the nearest operating room was 12 hours away by Black Hawk. The skin was cold under her fingers. She prepped it with antiseptic, felt the texture of the alcohol swab evaporate against the patient's chest, and positioned the needle. Muscle memory took over. Her hands moved with the terrifying fluid precision of someone who'd already survived the worst. The needle slipped between the ribs, found the pericardial space, and then, the hiss of air as the syringe drew back and fluid rushed in. Straw-colored pericardial fluid, the sign of a bleeding process, an inflammatory response, something slowly destroying the patient from the inside. The catheter went in after the needle. The tubing connected. The fluid began to drain into the collection bag, and on the monitor, the heart began to expand. The collapsed organ that had been drowning suddenly found room to beat again. The pulse pressure widened. The heart sounds, when Ashley listened again, were crisp and clear. She'd just saved a patient's life without authorization. Without witnesses. Without a physician present. Without a single person knowing that in the space between one breath and the next, everything had changed. She disconnected the tubing and stepped back. The sergeant major's vitals were stabilizing, the oxygen saturation climbing, the heart rate normalizing. The pericardial drain was functioning perfectly. The crisis was over. Now the real one was about to begin. The cardiac monitor's alarm screamed at 2:07 a.m., a sound that cut through the ICU like a scalpel through silk. Ashley's eyes snapped open from the chair beside room for 47. She was moving before conscious thought took over, muscle memory written into her bones by 2 decades of emergency response. The sergeant major's neck veins bulged, distended and pulsing with desperate pressure. The chest wall caved inward with each attempted breath, ribs drawing tight against collapsing lung capacity. Muffled heart sounds. Distant. Drowning. Cardiac tamponade. The pericardium filling with blood, the fluid sac around the heart compressing with each beat, strangling the chambers from the outside. She'd seen it in Fallujah. She'd treated it in field tents with equipment that was barely functional. Sacred Heart had better tools. Ashley didn't call for help. Calling for help meant waiting. Waiting meant death. She moved to the ultrasound machine at the bedside, her fingers finding the transducer probe with the certainty of someone who'd performed this procedure 1,000 times in her previous life. The machine hummed to life, screen glowing green in the darkness. She placed the probe in the subxiphoid position, the space below the breastbone where the pericardium lay just beneath skin and muscle. The image appeared crisp and immediate. Black fluid surrounding the heart like a dark ocean. The chambers compressed, squeezed, suffocating. The left ventricle barely filling. Pericardial effusion. Massive. Life-threatening. "I need the kit," she said, voice level as still water. The night resident froze in the doorway, too slow, too startled. Ashley didn't wait. She moved to the supply cabinet, hands reaching for the pericardiocentesis setup without hesitation, the 18-gauge needle, the syringe, the alligator clamp, the drainage catheter. Equipment she shouldn't be touching. Procedures that were beyond her scope. Irrelevant. She prepped the subxiphoid area with betadine in broad strokes, the orange antiseptic turning her gloved fingers the color of rust. The ultrasound guided her needle placement, the probe still in her left hand, directing the approach. She advanced the needle at a 45-degree angle toward the left shoulder, feeling the resistance of tissue, the give of the needle passing through fascia and muscle, and then the puncture. The entry into the pericardial space. Dark blood filled the syringe. Not arterial red. Not venous blue. The thick, deoxygenated blood of cardiac effusion, blood that had been trapped and stagnating around the sergeant major's failing heart. She drew off 120 milliliters. The cardiac monitor's tone shifted immediately, the rhythm strengthening as pressure released. Blood pressure climbing. 88/54. 94/60. The muffled heart sounds clearing, becoming crisp and strong again. The sergeant major's oxygen saturation rising from 78% to 88% to 94% in less than 90 seconds. Ashley threaded the drainage catheter through the needle track, advancing it slowly into the pericardial space. The needle came free. The catheter remained, positioned to drain any fluid that accumulated again, a safety valve for the next 12 hours, maybe longer. She secured the site with tape and gauze, then documented everything in the nursing record with the methodical precision of someone who'd written field reports under fire: time, procedure, fluid characteristics, patient response, vitals before and after. The sergeant major's chest rose and fell with easier rhythm now. The ventilator wheezed its mechanical comfort. The cardiac monitor beeped its steady, reassuring rhythm. Normal sinus rhythm. 76 beats per minute. The baseline vitals of someone who'd just been rescued from the edge. By 6:13 a.m., Dr. Whitfield stood in the ICU director's office reviewing the overnight notes. His face remained unreadable, jaw working slightly as he scanned the documentation. Ashley's careful handwriting. Her badge swipe logged into room for 47 at 2:07 a.m. The supply log showing the pericardiocentesis kit removed from inventory. The nursing notes describing a procedure that should never have been her responsibility. At 8:36 a.m., he called the medical board. At 9:19 a.m., Ashley sat in a conference room on the third floor with 3 board members arranged across a polished oak table like judges at an execution. Dr. Whitfield stood at the head of the table, his presentation methodical and surgical. His voice carried the tone of a man protecting an institution from dangerous negligence. Nurse Cooper performed a pericardiocentesis at 02:07 this morning, he said, his fingers moving across a tablet screen. A procedure explicitly outside nursing scope of practice. Without physician supervision. Without authorization. He paused, letting the words settle like stones. The patient stabilized, yes. But protocol violation isn't validated by outcome. The documentation appeared on the conference room screen. Badge access logs. Supply inventory. Her own handwritten notes describing every step. This represents dangerous autonomy, Whitfield continued, his voice smooth as polished marble. It threatens patient safety hospital-wide. If one nurse decides she's qualified to perform invasive procedures, the entire chain of command collapses. The liability exposure is staggering. The board members exchanged glances. Older faces. Cautious faces. The kind of faces that understood institutional risk better than individual heroism. Effective immediately, the board chair said, Nurse Cooper's ICU access is restricted pending formal investigation. All current patient assignments are being reassigned. A formal termination hearing is scheduled for Friday at 2:48 p.m. Termination. The word hung in the climate-controlled air like a scalpel. By 11:41 a.m., Ashley cleaned out her locker on the third-floor nurse station. Her name tag. Her stethoscope case, the one with Nurse Nobody still scrawled across it in permanent marker. The challenge coin, tarnished silver catching the fluorescent light, catching everything she'd been and everything she'd tried to become in this place. She placed each item into a cardboard box with the kind of mechanical precision that comes from emotional shutdown. Dr. Whitfield watched from his office window across the hall, his arms folded, his expression the satisfied calm of a man who'd successfully removed a thorn. The termination hearing was scheduled for Friday at 2:44 p.m. The board would use her own documentation to dismantle her. The procedure she performed to save a life would become the evidence used to end her career. Ashley drove home at noon. Emma's lunchbox sat packed on the counter, untouched. Carrot sticks and a turkey sandwich that nobody would eat. At 12:15 p.m., Emma found her at the kitchen table, shoulders shaking, face buried in her hands. The challenge coin lay on the table beside her, its surface dull as old bone. "Mommy, why are you home?" Emma's voice was small, uncertain, the voice of a child watching her mother crumble. Ashley pulled her hands away, forced them steady, forced her voice level. "Mommy just had a hard day at work, baby." She reached out, let Emma climb into her lap, felt her daughter's weight against her chest. But her eyes stayed fixed on that challenge coin. 14 years of discipline, 14 years of healing instead of leading, 14 years of choosing the Hippocratic oath over the warrior's path. She'd walked away from command to raise her daughter. She'd walked away from rank to save lives in civilian hospitals. She'd chosen the stethoscope over the command authority. And it had cost her everything. The silence lasted exactly 3 seconds. Then her phone vibrated. A text from a number she didn't recognize. Sergeant Major regained consciousness at 0645. Eyes open. Alert. Asking for you. Ashley stared at the message. Her hands began trembling, not from fear, but from the weight of what came next. What happened when legends stopped hiding? What happened when the quiet nurse who'd saved over 300 lives in Baghdad finally stopped being quiet? Emma nestled deeper into her embrace. "Mommy." "It's okay, baby," Ashley whispered, and she meant it. Whatever came next, whatever walked through these doors, she would face it the way she'd faced Fallujah. The way she'd faced the burning building where a 7-year-old girl had called her name through the smoke. The way a colonel faced impossible odds. But first, she'd let her daughter hold her while the world outside remained completely unaware of who was sitting at that kitchen table. What was sitting at that kitchen table? The ones who've seen the worst often give the most. The medical board convened at 1300 hours Thursday, 90 minutes before Ashley's scheduled termination hearing. Dr. Whitfield sat alone on one side of the polished mahogany conference table, his systematic documentation of Ashley's protocol violation spread before him like indictments. The administrator, 3 senior physicians, and the hospital's legal counsel occupied the opposite side. The fluorescent lights hummed their institutional monotone as the administrator opened a manila folder. "Dr. Whitfield's allegations are comprehensive," the administrator said, his voice carrying the precise neutral tone of someone about to dismantle a career. But reviewing the timeline chronologically presents a different narrative entirely. Whitfield's jaw tightened. He hadn't expected this. The board walked through it methodically. First, the reassignment of the sergeant major from Ashley's care immediately after she'd demonstrated superior clinical assessment in morning rounds. Then the memo restricting her ICU access. The staff meeting interrogations about pharmacology protocols she'd answered correctly 100 times before. The peculiar intensity of his attention to this single nurse, this single patient. Whitfield's documented evidence now read like a confession of systematic targeting, not professional conduct. The pericardiocentesis, the lead physician said quietly, performed without authorization. Undeniably outside her scope. Correct, Whitfield said, straightening. That's the violation. Walk us through your thinking, the administrator replied. When did you first restrict her access to room for 47? After observing her behavior around the patient. What behavior, specifically? Whitfield hesitated. There was no answer that didn't sound like jealousy. Excessive emotional attachment to a terminal case. The administrator exchanged glances with the legal counsel. And you documented this emotional attachment because it affected her clinical judgment. Yet her vital sign assessments were more accurate than yours, the lead physician interrupted, tapping the chart. Her recognition of cardiac tamponade preceded the ultrasound confirmation by 7 minutes. Her hands were steady enough to place a 14-gauge needle into the pericardial space under extreme time pressure. That requires training. Whitfield opened his mouth. Closed it. A nurse appeared at the conference room door, her expression carefully neutral. She held a security printout. The locker room vandalism from Wednesday, she said, placing it on the table. Security footage identifies the individual writing on the stethoscope case. The administrator pulled the image closer. Whitfield's silhouette was unmistakable, his deliberate hand movements captured in grayscale clarity at 08 for 7 hours Wednesday morning. Doctor, the legal counsel said, her voice dropping into the register of someone speaking to someone about to be fired, were you aware that workplace harassment and retaliation against a protected employee are federal violations? Whitfield's face drained of color with the speed of a hemorrhage. He tried to speak. Nothing came. You restricted access. You initiated termination proceedings. You documented her procedural competence as protocol violation instead of recognizing it as evidence of training beyond her stated position. The administrator closed the folder slowly. Your actions suggest a targeted campaign rather than legitimate performance management. The silence lasted exactly 3 seconds. Then the administrator stood. Dr. Whitfield, you're placed on immediate administrative leave effective now. Your hospital privileges are suspended pending investigation into workplace harassment and retaliation. You'll surrender your badge and access cards before leaving the building. Legal counsel will contact you regarding the scope of this inquiry. Whitfield gathered his documentation with shaking hands. The folder felt heavier leaving than it had arriving. He walked out of the conference room into the hallway where he'd once commanded complete deference. Now the faces turned away. The silence followed him like humidity. Meanwhile, in room for 47, the cardiac monitor beeped its steady rhythm. The pericardial drain functioned perfectly, the fluid that had compressed the sergeant major's heart now measured and managed. Ashley stood at the bedside, checking vitals without hurry, her movements carrying the kind of calm that comes from having already survived the worst. She didn't know about the medical board convening. She didn't know about the security footage. She was simply present, as she had been at the patient's side every shift since the emergency. Then the sergeant major's eyes opened. Not fluttering. Not partial. Open. Focused. Looking directly at Ashley with the clarity of consciousness returning from 2 years of darkness. Ashley froze, her hand suspended above the monitor. She had learned not to hope in this hospital. Hope was a luxury that got you written up, transferred, fired. But the eye stayed open. The gaze stayed fixed on her face. Reaper, the sergeant major whispered. Hoarse. Cracking. Real. Ashley's breath caught. She moved closer, not believing. Not daring. The sergeant major's voice strengthened, pulling from reserves that had been sleeping for 24 months. Colonel Reaper. Baghdad. 2004, you carried me out. The room tilted. The building was burning, the voice continued, gaining force. Jolan District. I was 7 years old. You wrapped me in your jacket and ran through the fire. Tears tracked down the sergeant major's weathered face. I'm Khalid. I'm Sergeant Major Khalid Hassan, United States Marine Corps. You saved my life when I was a child. I came back to my unit because of you. I served because of you. Ashley's hands moved on their own. She pulled the patient file. Read the name she'd known only as a child whose face she could never forget. The documentation that had meant nothing until this moment suddenly meant everything. Not a vegetative stranger. A boy she'd carried out of flames. A boy who'd grown into service. A boy who'd found his way back to her. I served, the sergeant major said, his voice now commanding, now official, now the voice of someone who'd given everything to this nation, under Colonel Ashley Cooper. 3rd Marine Expeditionary Force Medical Battalion Commander. Navy Cross recipient. 2 Silver Stars. 47 combat missions led. Every battlefield medic in theater trained by her hands. The monitor's rhythm remained steady as the sergeant major's voice moved through the hospital like a shockwave. The door to room for 47 was open. The hallway could hear every word. A Navy SEAL team leader stepped into the doorway. His presence moved the air. He wore dress blues, his chest a constellation of ribbons. He'd been visiting the adjacent room. Now he stepped fully into room for 47, and his voice carried down the ICU corridor with the precision of someone testifying in front of Congress. I can confirm, he said, his words crisp and official, that Colonel Ashley Cooper ran 47 combat missions in Helmand and Logar provinces. Trained every battlefield medic in theater. Medical rotations under her command showed the lowest casualty rates in U-2 Central Command. 312 confirmed saves under her direct medical decisions. 2 of those saves were me. The hallway had gone silent. Not the absence of sound, but the presence of attention so complete it created pressure. Dr. Whitfield stood outside the conference room. He saw the seal. He saw the door to room for 47. He understood what was happening 3 seconds too late. The hospital administrator appeared behind him, moving with the quiet confidence of someone who'd already reviewed every camera angle, every document, every piece of evidence. His expression was the smooth face of institutional closure. The security guard approached Dr. Whitfield with a cardboard box, identical to the one Ashley had carried out 3 days earlier. The guard's voice was professionally neutral, the tone of someone who'd been asked to perform this exact task and would perform it without judgment or pity. Doctor, I believe you know the way out. Whitfield took the box. His hands were shaking now. The badge was inside, already deactivated. His nameplate from the office. His personal items. Everything a career required had been packed while he was in the conference room. He walked toward the elevator, past the nurses who'd learned not to meet the eyes of falling men. Ashley stood at the nurse's station, the tarnished challenge coin in her hand. The same coin the Iraqi family had given her in 2004, worn smooth by 20 years of carrying it through every impossible choice. She placed it on the desk carefully, reverently, next to the equipment logs. The challenge coin caught the light, glinting like a promise kept. The sergeant major's voice echoed from room for 47, I came back to find her. I stayed in the Marines because she showed me what service meant. And when my body broke, I waited for her hand to find mine again. She never stopped coming. The medical board would formally exonerate Ashley within 48 hours. Dr. Whitfield's credentials would be under investigation within a week. The Texas Medical Board would open a formal ethics inquiry within 2. But none of that mattered in this moment. What mattered was the simple restoration of truth. What mattered was the man who'd been written off for 2 years opening his eyes and saying her name. Ashley walked into room for 47 and took the sergeant major's hand. His grip was weak but conscious. His eyes were wet. Welcome back, she said quietly. Welcome home, Colonel, he replied. The challenge coin sat on the nurse's station, catching light, bearing witness. The ones who have seen the worst often give the most. If this story resonated with you, if you've ever been underestimated by someone who didn't know your true value, or if you've ever stood by someone the world wrote off as hopeless, please like this video, subscribe to the channel, and comment below. Tell us about a time you were proven right when everyone else said you were wrong. Because these stories matter. These truths matter. And the people who refuse to abandon their calling, no matter the cost, they deserve to be remembered.